Hello, I'm Lena. Thank you for joining us for Connecting on Purpose, where we hope to not only connect you to our work, but to the amazing people doing the work. And today we have Brenda Goodhart, who is Baptist Health System Director, Women's Center. You went through the Baptist Health Nursing School, and you joined the Women's and Children's Unit right after that, right? So did you always know you wanted to be a nurse?
I realized I wanted to be a nurse when my grandfather was in the hospital after having a heart attack.
Oh.
I never imagined that I would end up in mother baby and NICU, labor delivery, but that really is where God led me as I think back through my journey. I started nursing school in '77 at Baptist, and they had a diploma program at that time. I worked mother baby after I graduated. Again, it was postpartum and gynecology at that time. I did that for about 6 months as an RN. Then I transferred back to NICU, and it kind of exploded and grew from there.
Yeah. So you've been in the same area for 40 years.
Yes.
And so you've grown professionally, personally, right along with Baptist Health. Tell me, what made you stay? What made you continue? What helped you to grow?
I tell the story a lot about what made me stay. I would not sign a 2-year contract with the hospital to have my tuition paid for because I said, what if I don't like it? It was a terrible financial decision. But
right.
I think as I really reflect back on, I've been in, it's been over 40 years now. I stayed because of the people. I stayed because I was allowed to grow. So that's what's kept me going. I've gotten to do a lot of different things and have different adventures in the organization.
Yeah. So our NICU is amazing, and you have had a lot to do with that. And we offer a lot more to women. And so can you just elaborate on that and tell everyone what we offer?
So let's talk about the NICU for a moment. Back in 1980, we have an average daily census of about 5. And we ventured out and developed private rooms for our patients. Now, we were busier than that. We had peak seasons, but we were the second hospital in the United States to have private rooms for our infants. And, it was built now more like an adult critical care unit, and to see the benefits that this has had, not only on the patients, our tiny patients, but the parents. It's less stressful if you're going in just to be with your baby when they're so sick. So I think that's been a really good thing that I've seen grow and change. Some of the services for our parents that we offer is CPR training for our parents, so they have that if they want when they're going home with their babies, if they're prepared. Prior to delivery, and we have newborn classes for moms and dads both. We've done CPR before where grandparents are other caregivers, so they'll feel comfortable watching their first grandbaby. Or maybe it's that the parents will feel comfortable leaving their baby. Newborn care classes, we do that. Then there's the sad part that happens is sometimes women lose babies and they do not have a miscarriage or just a neonatal death. And those are sad, and so we look for how can we create memories for the parents at that time. We've got lactation consultants that work with our moms. We're also doing some virtual classes and just consults where they can come in and ask, and we can make sure that babies get latched on.
Good. Well, this is the week before Thanksgiving, so this is a week of thanks. Tell us what you're most thankful for in working with Baptist Health.
I get a little bit emotional about this one, but I think the most thankful is that I work for an organization that it's okay for me to pray. And it is acceptable and encouraged for us to talk about Christ and the many blessings that we have that He gives us every single day, and it's in little things.
That's great. Thank you for joining us, and thank you.